I'm always pretty surprised when people tell me that the thing that scares them most about surgery is anesthesia. It might be because I'm a surgeon and I'm used to it, but I think it's more likely because I'm really thinking through where the risk actually lies. So the first rule in cosmetic surgery is if you're not a surgical candidate, you shouldn't be having an elective procedure performed. I never operate on patients who just shouldn't be having elective surgery. So right there, you're automatically going to select for someone who is a reasonable candidate with a minimal risk. Right there, the safety factor already starts. Second thing is in terms of anesthesia, the vast majority of procedures that are performed, invasive surgical procedures, are optimally performed under general anesthesia with the patient asleep and comfortable, but more importantly, monitored. The minute that you eliminate anesthesia, you eliminate the anesthesiologist. This is the person who is trained and equipped to monitor you during your procedure, make sure nothing goes wrong, adjust anything that needs to be adjusted, keep you safe, and wake you up comfortably. I personally love having that person around. And if I was having a procedure, I would want one or two of them in the room. When you have a procedure performed without anesthesia, you are trusting that you don't need that same monitoring, supervision, or intervention for anything. And depending on the procedure you're having or how big it is, that could be assuming some sort of risk. Important to keep that in mind. Although going to sleep is a scary thought for most people, the truth is, in many circumstances, being asleep is actually the safest. Your airway is secure, your blood pressure is controlled, and you avoid a lot of potential complications of having those two things not happening. Not to mention, as I said, having a very highly trained person whose only job is to monitor you while the surgeon is operating and focusing on that. For me personally, I'm very surgical. I perform mostly invasive procedures. I like to have my patients comfortable. There are procedures we perform under local because there are some for which it's completely reasonable. But by and large, I think having the patient comfortable, asleep, and monitored with vital signs controlled is optimal for most major surgical procedures, and that's sort of my preference. And if you really think about it, that's where you are actually safest.